In this video, we shall learn about the oxygen therapy by hood and by nasal cannula. Administering oxygen to sick neonates helps to relieve hypoxia, thus improving the oxygen supply to the tissues. Oxygen therapy is indicated in babies with breathing difficulty, with grunting, with central cyanosis, or with shock. It can be administered by nasal cannulae or by oxygen hood. The flow rate of the oxygen depends upon the device used and the degree of respiratory distress, as can be seen in this algorithm. Attach the oxygen tubing to the oxygen cylinder or to the central oxygen supply. Fill the humidifier with distilled water so that the oxygen delivered is humidified and not dry. Set the flow rate. Here, we shall learn about the administration of oxygen by hood. The flow rate is set 3 to 5 liters per minute. Observe if the bubbles are coming out in the humidification chamber. Remember, the flow rate should generally not be less than 2 liters per minute while administering oxygen by hood. Now, position the baby's head in the midline and keep a shoulder roll to keep the neck slightly extended. Keep the clean hood over the baby's head. The opening seen in the front portion of the hood should be kept at the level of the neck of the baby. Assess the improvement in color and the signs of distress after oxygen therapy has been initiated. If available, one should use a pulse oximeter to note the oxygen saturation. Adjust the flow rate so that the saturation is maintained between 90 to 93%. Let us now understand the important points which are to be considered while administering oxygen by nasal cannulae. Fill the humidifier with distilled water so that the oxygen delivered is humidified and not dry. Set the flow rate to 0.5 to 1 liter per minute. Observe if the bubbles are coming out in the humidification chamber. Remember, the flow rate should be adjusted as hyperoxemia can be damaging to the infant. Position the baby in the same way as explained earlier. Use appropriate size nasal prongs depending upon the weight of the baby. These prongs are available in 3 different sizes, separate for the neonate, for a pediatric patient and an adult. Secure the nasal cannula properly to avoid accidental displacement. Assess the improvement in color and the signs of respiratory distress after starting oxygen therapy. Oxygen saturation monitoring should be continuous in an unstable baby. In stable babies, you require monitoring about 12 hourly. In babies who are chronically oxygen dependent, this could be done 4 hourly. This helps to ensure that the infant receives appropriate levels of oxygen. Adjust the flow rate so that the saturation is maintained between 90 to 93%. Always remember, oxygen should be considered as a potentially toxic drug and should not be given any minute longer than it is required for any individual babies. Premature sick babies may develop retinopathy of prematurity following oxygen therapy. Thank you.